The doctors and nurses at the Alfred's Emergency and Trauma Centre can never tell what kind of injuries they'll be treating each day. But when patients arrive by ambulance, the emergency team is given advance notice of what to expect.
Bilateral collies, query posterior ribs, query sternum, large
A man
head
has
lap.
fallen at a construction site.
Patient coming via Micah 3. They've fallen 3 to 5 metres, landing on their head. Probably both wrists are fractured, large cut to his head, and probably ribs down the back.
Count 3, you ready?
Right,
1,
if we
2,
can, please,
3.
guys.
Okay, Pete's a 48-year-old gentleman known through the tissue that we know of. Working at a building site, he was up probably about 5 metres high, fell down onto a cement base, and it was one of those pipes, plastic pipes, that when he fell, the impact smashed that and it was all fragmented. So that actually cut his skull. He was in a lot of pain. That lac was actively bleeding.
Just take a few big breaths in and out for me, mate. Big breath again.
His external injuries are obvious. A deep laceration on the top of his head and 2 broken wrists.
All right, I'm just going to gentle feel the tummy here. Tell me if it's sore.
But it's the internal injuries which could be more dangerous.
Sore in there.
Of most concern is bleeding behind the eardrum.
Yep, impediment.
It means he has an internal head injury and possible damage to the brain. In a nearby emergency bay, wedding parents Jim and Gay are waiting to be x-rayed.
If I had my choice, I'd be with my boys in the pub having a couple of beers. That's what I'd prefer to be.
Their son's wedding is in 16 hours.
We'll get some x-rays of that, okay? Just to make sure that there's nothing else going on.
How are you feeling now? Have you got pain anywhere at all in particular?
My ankle.
Oh yeah, you got a nice big bruise coming up there. That's sore when I press there? No? It's not sore on the actual bone? No. Okay. I'll get some x-rays done, it's pretty swollen.
It's not a happy evening.
Gay appears to be the more injured of the two. Her potential injuries cover her neck, chest, back, legs and feet.
Because she's a high impact, we've done like a whole trauma series, which is the cervical, the lumbar, and the chest and the pelvis.
But as it turned out, the news for Gay could hardly be better.
She was quite tender about there, so looks pretty good. So this is a neck view. Yep, that looks pretty good too.
It looks as though Gay will make it to the wedding, once she's recovered from the shock of it all.
Just resting, I think.
Now for Jim. He's determined to be at the wedding, and outwardly he seems fine.
All right, now I'm going to feel along your back. Tell me if it's tender at any point. About here.
A little bit tender.
A bit tender there. What about there?
All right.
There?
A little bit tender there, yes. Somewhere around each side of that.
But that tenderness in his back indicates that he has done some damage. X-rays confirm it.
I'm looking at his cervical spine, which is where he's tender. He's got a bit of shift in his C1 and C2. This should be right in the middle, and it's instead there's a bigger gap here than here. So he'll need a CAT scan as well.
Well, have I got to keep this thing on?
Yes, you do, and you need to lie flat.
Right.
The CAT scan will reveal whether Jim's going to make it to the wedding. At the entrance to the emergency centre is the triage desk. It's where patients receive their initial assessment and are prioritised. Just arrived by ambulance is Ross, who'd been kite surfing at a local beach.
Right down, and he's lacerated the left hand, index, ring and middle fingers. Nice big flappage skin, especially on the middle finger.
Can you wiggle your fingers for me?
The lacerations were caused by the kite's strings.
Just didn't want the kite to hit anyone. Grabbed the strings. As I grabbed the strings, a gust of wind took the kite, ripped it out of my hands and just sliced it like a knife out of my fingers.
So what did it feel like?
Didn't feel a thing. It's also the blood spurting out from different directions. I didn't feel a thing. That's good. Oh, that's just sensational. Look at that. Love it.
Your fingers are still attached. So.
Oh, yeah, no, that's right.
As Ross's injured finger swells, his wedding ring will cut off circulation. His wedding ring will have to go.
get it off. Yeah. There we go.
Ross has been married for 7 years.
What's that feel? I'm a tree man. It's taking this damage.
We're going to roll you onto your side in a minute and have a tap down your spine to make sure none of the bones in your back have been damaged, okay?
Okay.
Construction worker Peter's condition is desperately serious, but there is some good news.
None of that's painful.
While he does have a serious head injury, his spine appears not to have been damaged.
No pain, still no pain? Well done.
However, the bleeding inside Peter's head is very dangerous. The CT scan should show how much damage there is to his brain.
Katie Murdoch to CT, please, Katie. Vomiting.
Peter has started vomiting. As well as creating a risk of choking, vomiting is sometimes a symptom of brain damage.
Hang on, just keep your head still, mate. We're just going to fix your collar up.
Must stay very still.
With Gemini and Google Meet, AI captures and organizes meeting notes, freeing you up to focus on the conversation. Get the meeting summary for every call. That's Google Workspace with Gemini.
Peter, you've had a really nasty accident, all right? And you've landed on your head. At the moment,
Peter is a construction worker. An hour ago, he fell 5 metres onto concrete.
All right. So on the CAT scan here, as you can see, he's got some air in the cranial cavity. And on the next view, it might actually be a bit more clearer. So you can see little black spots there, 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 and there. Generally, that's not the case. So when there's air in the cranial cavity, there must be obviously an evidence of a fracture somewhere to cause all that. Moving on, the other injuries that he has is a bit of blood in the brain as well. See all that white bits going across there and a black bit of air again. So all that's blood in the brain.
Peter's brain had been so severely shaken in the fall that blood vessels inside his head have been sheared apart. But the bleeding isn't his only problem.
On this view, you can see the fracture through the frontal bone of his skull. And he's got a cut above it as well, so essentially there's a portal where infection can actually enter the cranial cavity.
Bacterial infection of the brain is potentially fatal if not treated quickly with antibiotics. Adding to Peter's woes are the injuries to his chest.
The CAT scan shows he's got 3 fractured ribs on the left side. He's got some bruising to the lung and also a small hemothorax, which means some bleeding into the cavity where the lung is. What we're going to do now is to put a tube into that area to drain the blood.
I'm going to give you a little bit more anaesthetic, okay? Just try and lie still. I know it's uncomfortable for you.
Emma has found the phone numbers of Peter's relatives.
Okay, at the moment he's not breathing that well. We've got him on quite a lot of oxygen. So if things change, they may need to put him to sleep and just take over his breathing for him. That will just make sure all his organs get enough oxygen and his chest gets time to heal.
All right, so you've got a chest tube in now, so that should be helping the breathing. All right, good man.
Things could change by tomorrow morning. I can't tell you.
Basically, his breathing's deteriorated. He's becoming more and more hypoxic in that he's not breathing up all that well, and he's retaining a lot of carbon dioxide in his lungs. So because of the fractured ribs and his blood in his chest, he's just not breathing up all that well. So we had to put a tube in him to intubate him, just to control his breathing and have a ventilator work for him. And in the meantime, too, the plastic surgeons are here now to fix up his big laceration.
With so many critical injuries, there's a 1 in 5 chance that Peter won't survive.
One here. What's that feel like? Is it, yeah?
With Ross's wedding ring safely removed, Belinda's using a pin to see how much Ross can feel.
Yep. Over this side. No meshes it, yeah. Okay, so he's definitely got some altered sensation to that finger there. So what I do now is get the plastics unit involved. So I'll contact them.
I could always say it was a shark or a big snapper.
Well, your tendons are all intact and your nerves are all intact. I can see that, that's fairly obvious. One of the little blood vessels which goes down to the end of your finger has been torn. And unfortunately, you've nearly removed this entire flap of skin. It's hard to tell whether it's actually alive or not.
If the flap of skin still has a blood supply, it's alive and can be stitched back on. If there's no blood supply, it will be removed and Ross will need a skin graft.
It'd be absolutely miraculous if it was alive.
Jim's CAT scan will reveal whether there's any fracture to his neck or spine. If there is a fracture, he won't make it to his son's wedding.
Yeah, he's got lots of degenerative change, but I can't see a fracture.
But looking at it looks alright though.
Yeah. And I can't see an obvious fracture.
Yeah. Alright, very good, thanks.
Okay, so
Jim's about to hear the good news, that he can make it to his son's wedding.
So we'll let you go home. At any stage, if you get any pain in the neck or severe pain or anything like that, or things are not getting better, please come back as soon as possible. And tomorrow, when you wake up from sleep, you'll feel a lot worse than you feel tonight. Essentially, the treatment for that will be rest, some heat to the area, some painkillers, anti-inflammatories, and it should take its time to resolve itself, probably within a week or so. All right?
Both Jim and Gay will be stiff and sore, but at least they'll both be there.
I have 4 sons and 3. Right, tomorrow 3 will be married, but I still have 1 to go. So I hope that won't be as memorable as this one.
The nearby Sandringham Hospital, known to the locals as the Sandy, often copes with life's smaller emergencies.
And what happened to you, Jennifer?
I was up on a tree house and I was climbing down and I decided to jump.
Yep.
And I landed on this piece of timber or metal.
Okay, and now you've got a cut on your foot, have you?
I'm Dave McCall, I'm one of the doctors. We'll have a look and see what we need to do. I reckon. Let's have a little bit of a wash. Get all that goo off.
It looks like slime.
Looks like slime. So it's about a 2 to 3 centimetre laceration. It's all pretty superficial, but it's deep enough that it will need some stitches to close it up because it's the ball of her foot, she'll be walking on it. All right? So we'll get a few things set up that we need to do and then we'll start.
Children have a heightened sense of pain and often don't receive enough pain relief. But doctors at the Sandy are used to kids.
So we'll give her some nitrous oxide to breathe on. As she's breathing it in, it works. When we stop giving it to her, it wears off really quickly. It just means that
just
when
as
I'm
little
putting,
as you think you need, because I'm not very into...
It's just that when I'm putting a local anaesthetic in, I just rather than have it as a traumatic experience for her.
Nitrous oxide relaxes the nervous system. Administered carefully and in small quantities, it's harmless. And it's no wonder it's sometimes called happy gas.
Sounds going to be giggly. Everyone's got this.
Don't stir it too much. And just add the tiniest bit of hot paprika. Hot paprika? Yeah.
Amarok V6. Who said tough had to be rough?
Is it spicy? Yeah, it's spicy. You don't like spice?
I mean, I'm more of a parsley kind of guy.
Some people reckon this is the Aussie way. Sure, but at Aussie Broadband, we reckon there's a little more to it. Like providing our reliable services wherever you go with fast 5G mobile. So your family group chat can see Jack on the swing and Jack falling off the swing.
I'm okay.
With great data inclusions and coverage and great value mobile plans with no BS.
Did you see that, Dad?
That's Aussie Broadband. That's the actual Aussie way.
imagine what you could be buying instead.
For free and confidential support, call the number on the screen or visit the website.
We're all unreasonable about something. For us, it's creating an uncompromisingly delicious bourbon. Handcrafted, consciously made. Maker's Mark. Perfectly unreasonable.
Out in the yard, the old tradie stands, grasping their tools in their long, hardy hands. Click, go the shears, mates, click, click, click. Wide as the blue and our hands.
It's all right, Jennifer. Just breathe normally. 7-year-old Jenny has cut her foot and she'll need a couple of stitches.
She's mine. Very impressed with how brave she's been.
Really still. Sharp needle now.
The suturing thread is made of nylon. Some sutures dissolve after a week or so, but this stronger, non-dissolving nylon thread is needed to cope with the pressure and movement of the foot.
Still needs to be kept dry for the next week.
For the next week.
Yeah. The foot takes a little bit longer to heal up, and the risk is that if it gets a bit moist, it's going to increase the risk of infection.
The stitches will have to be removed in 7 to 10 days.
I think that's about it.
How many stitches, Dr.
We're just 3 stitches
How's
there.
that? So what do you think it looks like, Jennifer?
A hedgehog.
Hedgehog.
Back at the Alfred, construction worker Peter is also having stitches on top of his head. The deep laceration in his scalp has exposed his fractured skull.
The fractured skull does heal by itself, ultimately, but because there's a big laceration above it, there's a risk that there might be infection going in, so we give him some antibiotics to treat that, and also we need to obviously fix up the laceration above it. But the bone itself will heal in due course over the next few months.
Hello, this is Peter's mum.
How are you? I'm Kathy.
Peter's mother and sister have arrived.
How's he been?
He's been going okay. The doctors came in and they were a bit concerned with him earlier on. But you can come in and have a speak. I can come in and see. Have you seen
Peter's condition is still critical.
You saw the tube with
The bleeding in his brain could have caused permanent brain damage.
He'll be okay.
Kite surfer Ross will have to have a skin graft if the flap of skin on his finger doesn't have a blood supply.
Oh, by golly, it's alive. As Dr. Frankenstein said. Oh, it's bleeding.
Miraculously, the flap does have a blood supply.
Hooray! Isn't that wonderful?
The flap can simply be cleaned and stitched back.
It's beautifully dissected.
Yeah?
I could do a better job.
I'm sure you could.
The slice was so neat it revealed Ross's tendons, nerves and blood vessels.
Oh, look at that. Looks like something out of Leonardo da Vinci's textbook.
Photos of interesting cases are often taken, with the patient's consent, for training purposes.
She's going to email it to me, aren't she?
Absolutely, yeah. This is just screensaver.
Yeah. That's it. I don't particularly want to see the inside of my finger ever again.
In the middle of the emergency and trauma centre is the flight deck. It's where all patient movements are monitored and where calls come in warning of incoming patients. On her way in now is the victim of a car crash. The patient was trapped in the car for 40 minutes. Rescue workers had to cut her free.
How are you going there?
She's 18. She's had her P plates for just 1 month.
Matthew, I'm one of the doctors. Can you speak at the moment or not really?
Okay.
1, 2, 3, 4.
Rebecca was driving her car when it spun off the road and hit a tree.
Rebecca's an 18-year-old lady. She was the sole occupant of a vehicle that split the road and impacted a tree at high speed. The tree impacted on the driver's right front quarter, pushing the dashboard down onto her legs. Is it sore in the tummy?
Rebecca has a rigid and tender abdomen, which could mean she's bleeding internally.
What we look for is any blood that might be free in the abdominal cavity.
Your shoulder, up here.
That's usually if one of the organs, like the spleen or the liver, has been ruptured. It will bleed profusely.
She's also in shock, so finding a vein isn't easy.
That's the way. Squeeze hard. Squeeze my fingers hard. Open, close. All the veins have shrunk down.
It took Matt a few minutes, but eventually he succeeded.
Got in.
So Rebecca, this ring that's in the side of your nose, can we take that out?
Rebecca will need a CAT scan, but first, all metal will need to be removed.
She's stable, conscious and talking to us. So
Rebecca's parents are on the way to the hospital.
All right. We'll see you when you get here. Bye-bye.
In the next-door trauma bay, Peter is unable to breathe by himself.
Okay.
Oxygen is being pumped into his lungs through a ventilator.
Okay. You can hold his fingers if you like or whatever. They are warm. That's good. That means he's getting some circulation there too, so that's good. Yeah. Go sit down.
Peter's fall has affected the blood supply to his brain. A CT scan and an angiogram should reveal how much damage has been done.
Peter's in a fairly critical condition at the moment. He dropped his blood pressure a little bit and things, so we had to control that with medication. And now we're in the process of going to CT to have a scan of his head and also an angiogram of his neck for one of the main veins of his neck to make sure that everything's intact there because he has got a fracture around that area.
If the fracture is restricting the carotid arteries, then little or no oxygenated blood is reaching Peter's brain.
These two white dots are the carotid arteries going up into the neck. Now, if we just follow those up, they're entering the brain at that point, and they look fine. He's lucky from that point of view. He's got multiple fractures of the skull base, but this test has shown that his blood vessels are all fine.
Yeah, I'm just taking him up to ICU, where he needs to be because he's critically unwell.
Okay.
Yep.
Over the following 4 weeks, Peter's condition gradually improved. He's been taken off the respirator and has now started to talk. With sustained rehabilitation, it's hoped he'll recover his quality of living and even return to work. Ross's finger took 3 weeks to heal. He says he will go kite surfing again, but next time he'll wear gloves.
Ta-da! There you go. You're a star patient.
Jenny had her stitches taken out after 10 days. It'll be a little while longer before she runs around barefoot. Gay and Jim did make it to the wedding.
Behind this bathroom door lies the everything shower, where nothing is left behind.
Introducing Gemini in Gmail, Slides, and more. Powerful AI that helps businesses be more productive. With enterprise-grade security and chat, everyday tasks don't take all day with Gemini for Google Workspace.
The Alfred emergency team has been advised that a stabbing victim is coming in. Within moments of arrival, the patient is being handed over to the emergency team.
Stab wounds, right and left scapular shoulder blades, left bicep.
The woman has lost over half a litre of blood, and as yet she has unknown damage to her internal organs.
Approximately 500 mils worth of blood, I suppose, but a lot of blood was soaked into clothes and whatnot.
George, we're just going to do a CT scan.
In the CT scan room, George's unconsciousness may be caused by his chest infection, depriving his brain of oxygen. But there could be another cause.
Because he is unconscious, we need to exclude that he's got a bleed in his brain. So does it show any acute bleeds or just that
there's a chronic
abnormal?
subdural that he's always had apparently.
It's bad news for George. Instead of simply having had a stroke,
All finished, George.
it's now clear that his brain has been starved of oxygen.
He doesn't actually have an acute bleed in his brain as such. I'll just grab the chair. So in that instance, I guess we can assume that he's had a respiratory arrest at the nursing home.
You ready?
Yep. 1, 2, 3. Possibly as a result of his chest infection that has been brewing over the last week or two. Just taking you back to your room now, George.
The lack of oxygen has caused brain damage, and there's now little anyone can do.
There's a trolley behind you.
George's son and daughter-in-law are on their way to the hospital.
We really have to make the decision as to whether we're going to be aggressive in his treatment or whether we're going to make him comfortable, basically. As you can imagine, it's a very sensitive time when you've got to tell family that someone is particularly unwell. It's someone that is obviously very close to them, and that the hardest part is telling them that they probably won't survive. So in a way we have to decide the most appropriate course of treatment and then provide the family with the reasons why. What I'll do is I'll put the side of the bed down and then you can hold his hand and you can be with him, all right? Okay. I can manage to keep him comfortable with a bit of morphine. After that, I just feel that it would be unfair on him to really keep it going. All right. And obviously, if anything else were to happen, like his heart stop or whatever, in the meantime, we would just turn the ventilator off and allow the inevitable to happen. All right.
We've had a family meeting with Mark and his son Danny and his wife, and we've basically decided what's best for George, and we've all agreed that at 91 he, and in the serious condition that he's in at the moment, it's very unlikely that he's got the fight left in him to actually get over this chest infection. So we're just going to do the right thing by George and take that tube out, make him comfortable, and let him die with dignity.
George died peacefully the following day, his family by his side. Rebecca stayed in hospital for 8 days. She's now back at work as a veterinary nurse, but she's yet to get behind the wheel of a car. Netball mum Philippa left hospital after 2 hours.
I'll still be walking, I'll still be running after a 2-year-old and doing all those things. But as far as netball, I think I'm out for, sounds like...
Car crash victim Sylvia had her head wound stitched up, and the paramedics did find her phone. A crash like this would have been fatal if she hadn't been wearing her seat. 4 weeks later, he can see, but not well enough to read.
I've been in very good hands, so I feel very comfortable with that.
In due course, he's expected to make a full recovery.